National School Food Conference in Canada. So we've been doing some follow-up ongoing webinars, and we'll have some more coming up. So best way to keep track of some of these ongoing knowledge exchange opportunities is by going to the website that you see at the bottom, changingthemenu.org, and ongoing activities, and we have a bunch of things coming up, so we'll keep you updated. And so now the next slide is just to tell you about who our partners are. So Changing the Menu, the conference that we had, and also it's part of a national school food initiative that's called Nourishing School Communities, and it's funded by the Canadian Partnership Against Cancer. And here are all our partners there listed that are part of the Nourishing School Communities initiative. So again, we are working together on this type of work, and so we just wanted to recognize all the partners as well as recognize the funding agency, Canadian Partnership Against Cancer. And so today we have two presenters. We're going to have Mary McKenna, who's the professor and faculty of kinesiology at the University of New Brunswick in Fredericton, and she's going to be speaking, as well as we have Chris Politis, who's coming to speak on behalf of the Canadian Partnership Against Cancer. As I mentioned, they're the funding agency for our Nourishing School Communities CLASP initiative, and he'll be speaking a little bit more about CLASP and as well policies and sustainability. So here's the agenda. We're going to first have a little bit of an introduction on the role of policy to support changing the menu, and then Chris is going to speak around policy development for sustainability, and then we'll go back to Mary, who will speak about the current state of school food and nutrition policies in Canada, and then as well giving some examples of Canadian school food and nutrition policy initiatives. So just a few housekeeping things with regards to audio. You will notice that you are muted. The audience will be muted throughout the webinar. So if you are experiencing any issues with the sound, you might want to just make sure that if you look at the left-hand column, it will tell you the dial-in number and the audio pin. So don't look at the slide, look at what's on your own screen, and just make sure that you're able to access it. You can either listen through your computer speakers or listen through the phone. And this webinar will be recorded as well, and it will be posted on the Changing the Menu conference probably later on today. And so because you're not able to ask questions, we do encourage you to use either the question feature or the chat feature throughout this webinar. So again, if you have any questions or any comments throughout the webinar, we'll be monitoring those fields throughout, and we'll have some time for Q&A towards the end of the webinar. So please put in your questions there so we can be ready to ask them when we have the Q&A session. As well, we will be doing a few polling questions throughout. So again, there's ways that you can actually put your answer into some polls that we're going to have. So you'll see that when those pop up. So we're going to start just by finding out where people are from. So we have a map here, and we want to hear from you where people are from on the webinar. So unfortunately, our drawing tools that we have, we're not able to get everyone to actually draw on the map at this point in time. So if you're able to draw, go ahead. If not, what you can do is just put in your province into the chat function, and so we can just see again who's here and where people are from. So you can just go ahead and do that now. I see some people putting in their drawing tools. It just takes us a minute. Unfortunately, we weren't able to get everybody. If you're not able to draw, just put it into the chat function. We'll get a sense of where people are from. So you can do that while we go. And now I'm going to switch over to pass things over to Mary, our first presenter. Great, and I believe Mary's also going to share her webcam, so you should be able to see her as well as listen to her speak. I'll just take a minute here to switch things over. Mary's getting ready. There she is.
Okay, I can talk. Now, how do I get it that we go back to the presentation?
You have to bring up it on your computer.
Oh, you know what? Then, Micheline, why don't you do it?
Okay, that's fine.
Yeah. But in the meantime, very happy to be here. I see some familiar names, and I see, thanks, Micheline, and I see some names that I don't know, so that's great. I'm starting off today to just talk about my own vision, and this is actually something that I did present in Montreal, but I think what it does is it helps situate policy in the overall context of school food and nutrition. So if I had to say, you know, what is Mary McKenna's vision for healthy school food and nutrition, I would say that it becomes a normal expectation of schools, and actually being able to continually think about this topic, I would also add supported. And I think that that's a large part of what we're talking about today, is the support that we need to try to ensure that all children in Canada can have access to healthy, nutritious, and appealing food. I also just want to draw your attention to the word in the center of enjoyment. And I think, again, that that's really important in terms of modeling, in terms of we think of our own behaviors. We're a lot more likely to do something if we actually enjoy it. So that puts onus on having high quality food, thinking about the presentation of the food, and all those aesthetic aspects. Okay. Also, too, so that we're on the same page, and just a quick definition of policy. Food and nutrition policies provide a framework by which schools can plan, implement, and evaluate food and nutrition-related actions, ideally using a coordinated approach and one that reflects current dietary guidance. And you can see on the right is the logo for Comprehensive School Health, and I see Susan is on the call. And so you can see that policy links and is integrated with the social and the physical environment of the school. So in terms of food, all of the facilities and outlets and behaviors that are encouraged or discouraged around school food, so that would be the social aspects of it, and very importantly the teaching and learning, and that can occur in and outside of the classroom, and the environment also ties into that in terms of what facilities are available for cooking, food preparation by food service staff, gardens, greenhouses, etc., and also the partnerships and services. And we know that when it comes to food and nutrition, the school is not an island by any means, that there's lots of people who are partners with the school to ensure and to encourage and support healthier food and nutrition. The other small point that I want to make is that for the most part today I'll be talking about formal policy. So these would be ones that would be formally adopted often by government or even at the school level, and as well there are informal policies. So at the very end, Micheline is going to be doing a little bit of presenting of some examples of some of those more informal policies. Paul Fieldhouse and I and Marie-Yves Gilbert presented at Dietitians of Canada this past year, and I'm not giving credit, which I should, University of Prince Edward Island, Jen Taylor and one of her students actually did an informal survey across the country of provinces that were involved with policy. And you can see too, if you're looking at the numbers, you say, wow, they add up to more than 10 provinces, and you're exactly right. So it is indicative that, you know, that these policies came about for a variety of reasons. So if you're on the line as working with government, then the politics and the political directive can be important, so you can play a role in trying to help move that forward. If you're on the line today as an advocate or a member of a non-governmental organization, you can see that you also can be influential. If you are on the line as a researcher or involved with evaluation or monitoring, evidence-based decision making, Chris is going to talk a little bit about that, then that also can have an influence. And then you can also see that this desire for alignment. So basically it's like, you know, if New Brunswick is doing this, maybe we should be doing it. And so thinking about kind of how we can move that forward. And then also looking at the issues that are motivational. So access to food, childhood obesity, just the quality of food and food intake and the health relationship risks. And that slide is a little bit, it didn't transfer perfectly well, but I hope you get the sense of if you're looking to try to motivate people for further involvement around policy, then those are some of the issues that you may want to consider. And just again, quick background that many of the provinces across Canada have developed provincial policies, and they require the implementation. Now, we'll see that that requirement isn't always fully implemented, but that is the desire. At the same time, we have a couple of provinces, that Manitoba and Saskatchewan, that develop provincial guidelines, and then they have asked school districts to develop policies based, and they can use those provincial guidelines as references. And then Alberta developed provincial guidelines but do not require. So whereas with the New Brunswick, for example, it is required, or Ontario it is required, Alberta it's recommended. And Quebec developed provincial guidelines as well, and also encouraged their school districts to develop guidelines, and again, those are not required. So again, many provinces provincial level and required, a couple of provinces provincial level but requirement at the school district level, and lastly 2 provinces that they are recommendations and not requirements. Also too, and you'll see when I come on again, I'll be talking about research and monitoring that has been done around Canada on school nutrition. And this work has prompted me to think to take a step back and look at larger issues. So I'm throwing out these questions that I will come back to towards the end of the presentation, and I'm encouraging you to think about them and use a chat or have further questions. There's people on the line here who have a lot of experience as well. So use the technological tools that are at your disposal by all means. So throwing out these questions: how can policy be used to help school food and nutrition to become a higher priority within the educational mandate of schools? So traditionally, school food services were seen more as an administrative mandate and not as part of the educational mandate, or kind of as on the side of the plate, so to speak, of school food. So how can we use policy to get it more central and more of a priority and part of that educational mandate? Secondly, we know that today's food supply is very complex, not only in terms of the processing that occurs, but also even, if I say pizza, maybe some of you have a healthy pizza that comes to mind. Some of you have a, the bacon wrapped, cheese stuffed, whatever pizza that comes to mind. Muffins, granola bars. There's many foods out there that kind of are in that, purgatory zone of school food. So it becomes impossible to have a reasonable, we are not writing War and Peace here. We're actually, writing a policy. So how do we help schools understand the spirit of what we're trying to get across? Because it would be, I would venture to say, impossible to have the letter of a policy follow to provide guidelines that cover, absolutely every possible aspect of school food and nutrition. So I'll let you ruminate on that as well. And lastly, what is the role of policy? So of course today the emphasis on policy, but policy is one tool that can be used, and there's also, as the Canadian Partnership Against Cancer reminds us, is that there's programs, policy, and research. So how do those three work together, or are there other dimensions as well? So with that in mind, I'm going to pass it over to Chris, who's going to talk about policy and sustainability. Thank you.
Great, thanks, Mary. So Chris, I'm just going to pass the slide capability over to you, and so you can pull up your slide deck, and I'll let you introduce yourself.
Okay, thanks. And let me know if you can see my my presentation. Is it up on the screen?
Not yet, but I can see.
No? Okay. Show my screen. Can you see it now?
Yep.
Yeah.
Okay,
You're
perfect.
ready. Great.
Okay, thanks. Thanks, everyone. I'm just going to preface my entire presentation by saying I am getting over a cold, so the clearing of my throat and sniffles I'll try to keep to a minimum. There's both of them. But I am happy to be here and present on policy. As Michelin and Mary mentioned, I'm with the Canadian Partnership Against Cancer. We're a federally funded organization. We've been funded for 2 5-year mandates. We're currently going into the last year of our second mandate, but really great news yesterday in the federal budget. We were renewed. We don't really have a lot of the details yet, but it's nice to know that even though this is the final year of our second mandate, there will be more years to come. So I'm coming from the context of we're an organization that implements Canada's cancer control strategy, which spans the whole continuum from prevention through system performance, diagnosis and clinical care, patient-centered perspective, etc. And I'm with the prevention team, and we have several initiatives that have really looked at policy capacity building, as well as our CLASP initiative, which I'm going to speak to later, which is really accelerated policy change in several areas, and I'll speak more to that later. So I am going to talk about policy as a way to sustain efforts and outcomes of work. But first I wanted to touch on a couple areas of policy development, specifically evidence and policy processes, because I think you know, I won't be able to do them justice. I'm going to just spend a couple minutes on each, but just really to provide some food for thought and some early thinking. So first, I wanted to define what I mean by policy, because as Mary mentioned, you know, there's formal, there's informal, and really at CPAC we see policy as being a decision that's really either organizational or governmental, and it results in a shift in decision making or practice. It has an impact on a population level, so the group that's underneath that regulatory jurisdiction or organization. And it can be legally binding, it can be voluntary, it can be somewhere in between there. And it can really sometimes just signal a shift in prioritization of efforts or resources. So some examples are sort of the traditional written policy, if you think of legislation or municipal bylaw, but we also include things like a budget change that allocates resources differently and causes people to work on different things or work differently, or a leadership decision that has a similar effect. And so when I speak to some of our CLASP examples, I'm hoping you'll be able to see some of these different types of policy outcomes or policy changes come through. So policy, I think going back definitely at least to the World Health Organization Ottawa Charter has been recognized as a powerful tool to improve population health. Like I mentioned, it has an effect at a population level, so it can have a broad reach and a broad impact. And generally speaking, it is sustainable in the absence of funding. Obviously, many policies have an enforcement component that can cost money, but many policies actually are self-enforcing. Once a policy is enacted, it generally remains in place for a reasonable period of time. Policies, of course, can be changed, can be repealed, can be removed, especially if we're talking about leadership decisions or budget decisions. But they often have a period of time that they're effective without a constant injection of funds. And when we talk about healthy public policy, policies can create supportive environments to make healthier choices the easier choice. So they really enable people to make healthier choices by changing the environment. So the first piece of policy development I wanted to touch on is this concept of evidence-informed policy. And I think there's often a question, you know, what do we mean by evidence? What's the best evidence? And so when we think about evidence, there's lots of different types out there, and they themselves are on really a continuum from objective to subjective, with some of the most rigorous evidence being, you know, systematic reviews, and then we can move to more subjective forms of evidence, such as anecdotes, personal experience, that kind of thing. And really, there's a place for all of these different types of evidence depending on your context. And I think you'll see in the case of policy that often the subjective forms, that real world evidence is really what tends to be used. But I have a colleague, or a former colleague, who had a saying that he used to bring out a lot, which was, evidence is really like beauty. It's in the eye of the beholder. It's really dependent on your context. So do the available systematic reviews for a program or policy intervention, are they even applicable to the population you're dealing with? What are your resources? Do you have the capacity to implement, a highly tested or researched intervention, or do you need to use a policy intervention that's maybe less evaluated but has been used in a similar context to yours? So I wanted to pause before I get into my other slide about evidence and have a poll question, just to really get you to reflect a little bit and think about, in your own personal experience, how important a role do you believe evidence should play in the development of policy? So this is should, not what it actually does in real life. And I can't see the poll, so Michelin, I'll need you to tell me.
Yeah, it's been launched, and so far we have 50% of people on the call who've submitted, so we'll just give everybody another 15 seconds or so to put in their responses. So far, very important is leading with 53% and important 45%, and then 3% for somewhat important and 0% for not important.
Okay.
So I think that's it. We have 94% that have voted, and that's the percentage.
Okay. Excellent. So it was sort of overwhelmingly on the very important and important side.
Yeah. So right here, they can see here now, everybody should be able to see the polling results. So great.
Okay, and I think that is generally a prevailing opinion or thought, especially in the public health world, I'd say definitely in the academic world. But how does this actually play out in real life? So this is a slide from Professor Fafard at the University of Ottawa, a political scientist, and he presents what he calls a more realistic view of what actually informs policymaking. And this is definitely on a government perspective, not necessarily an organizational policy. But you can see there's a wide range of competing factors here, from economic interests, social movements, court precedent, what other governments have done. Court of public opinion is always important when we're talking about policy. So you can see that scientific evidence plays a role, but the role that it actually plays is often quite small. And we have to keep this in mind when we are pushing a policy agenda or policy idea forward, that there's a lot of other competing factors that the decision makers are weighing out and ultimately using to inform their decisions. So ultimately, scientific evidence is not the be-all, end-all. So that's really just some food for thought around evidence in policymaking. And I wanted to move on, now that I've touched on some of these competing factors that go into the decision around policymaking, to some ideas about how the policy process actually occurs. So I do have another poll question, just to kind of gauge where people stand, and again, to get you to reflect on what your comfort level is with the policy process and policy development frameworks or theories, and how this actually happens.
Okay, so we still have people submitting their responses here. So far we have about 17% not comfortable, 63% somewhat comfortable, 15% comfortable, and 7% very comfortable.
Okay.
So actually most people sort of around the somewhat comfortable and lower towards comfortable, very comfortable.
Okay, well, unfortunately, I'm not going to be able to bring everyone up to the very comfortable in the couple minutes I have to talk about policy process, but I do have a couple citations on my next slides that will hopefully point people in the direction of some extra resources. And I think my main point I want to get across, let me see if I can advance my slide here. There we go. Is that the policy process is really complex and it's not linear. So when we think about how policy happens, we often think of something sort of in line with this green diagram where it's you have an agenda setting stage, you formulate your policy, the policy is adopted, it gets implemented, there's evaluation, and then you kind of go back and revise that policy, improve on it, etc. And this is really appealing because it's so simple, but it's not actually the way this tends to roll out in practice. Policy is often a much more complex interplay of the factors that you see in the orange and gray boxes on the right, sort of being mashed together over time. So policy actors, policy ideas coming together with various tools and instruments and in various organizations or institutions. And then ultimately a policy comes out at the end. And I have another colleague who has a great saying that there's two things you don't want to you don't want to see being made: sausage and policy, and that's because both are extremely messy processes, and they're not really all that appealing during the process. But at the end, you have something that's, well, I guess depends if you like sausage or not. If you're a vegetarian, you wouldn't like the outcome of that. But all this to say that the process is very nonlinear and complex, and what can be helpful sometimes are some of the available policy frameworks and theories that exist. I've just pulled two out here just to kind of illustrate this, and you can see at the bottom there's a citation from Peel Public Health that you can look up more on these particular frameworks and theories and some other ones as well. But just as an example, these can help sort of theorize and understand when there's a policy opportunity, what sort of resources and capacity you need to mobilize behind you to be ready to bring forward a policy idea, and sort of who your allies could be, and how you can actually embark on this. So the first, multiple streams, is really positioned for ambiguous problems where the solution might not be clear. And an example of that would be menu labeling. There's lots of different solutions out there. Which one's the right one? And the multiple streams puts forward an idea that there's three streams that need to come together or be activated, and when they're all in place, the policy opportunity window opens, and that allows the policy entrepreneur, so someone who has a solution, who's ready to bring forward this idea, and there will be organizations or jurisdictions or decision-making bodies that will be receptive to this idea. On the other hand, there's the advocacy coalition framework theory that really presumes that the policy issue is two-sided. So there's a position group on one side and a position group on the other side with opposing viewpoints, and it's a matter of beliefs and advocacy strategies and evidence that can be used to bolster positions and ultimately sway the opinion of the decision maker to enact a policy in favor of that group. And I think we've seen that through public health causes such as tobacco and tanning, for instance. So these, again, I wouldn't say that policymakers sit down when they want to create a policy and say, okay, we're going to use the multiple streams theory when we want to create this policy now. These are really theories that are sort of retrospectively placed on a policy process to explain how something actually happened. But they can be helpful when you think through the issue that you're trying to cover, how you can kind of think through that. So I'm going to speak to a couple examples from our CLASP initiative about how policy can be used for sustainability. So the CLASP initiative, really quickly, was developed to implement evidence-based programs and policies through funded projects, and they did this by addressing cancer and chronic disease risk factors in a variety of settings, in a multi-jurisdictional fashion, in a multidisciplinary approach, research, practice, policy, and through several phases. And at the completion of the first phase, of our project, of the initiative, we've documented 239 policy changes or new policy changes, new policies enacted that we really see as the key way that CLASP efforts and outcomes are going to be sustained beyond the funding period. So I wanted to pull a couple examples of healthy eating policy changes from CLASP, from our Collaborative Action on Childhood Obesity project, which was really looking to reverse the escalating trend in, or at least contribute to a reversal in the escalating trend of childhood and youth obesity through several programs that made up a comprehensive approach. The Healthy Beginnings for Preschoolers 2 to 5 program, which was really about developing evidence-based programs and toolkits for early learning practitioners in childcare settings. The Healthy Food and Beverage Sales Initiative, which was designed to facilitate the voluntary restriction of unhealthy food in municipal rec facility vending machines. And the Land, Sea, and Based Food Procurement for Indigenous populations, which was to develop traditional food procurement capacity by bringing elders, hunters, and food preparers together with youth to share local and traditional food procurement strategies. So some of the ways we saw these programs sustained through CAECO, through Collaborative Action on Childhood Obesity. For instance, the Healthy Beginnings for Preschoolers 2 to 5, we had childcare sites remove sugar-sweetened beverages and unhealthy snacks from their centers. The program itself was recognized as a professional accreditation opportunity for early learning practitioners in 2 jurisdictions. And the government of Northwest Territories actually endorsed the toolkit and has integrated it into childcare programming in that territory. The Healthy Food and Beverage Sales Initiative, there were 4 rec centers that developed policies to provide healthier food options in their vending machines. And in the Land, Sea, Based Food Procurement Initiative, 3 communities integrated that program into their school curriculums so they can continue to offer it to the youth in their communities moving forward. So you can see there's a real mix here of those written sort of regulatory policies through to more, leadership decisions, organizational decisions to continue something or to integrate it into the practice for a professional group. So just some lessons learned, because I know I'm running out of time, but these are from our entire CLASP initiative with respect to policy change. Champions are really important. Engaging them early and often upfront is really a key lesson learned for us. Flexibility, so striking a balance between fidelity to your program design and adapting to context. Sometimes if you can only sustain a piece of your program or a piece of your work through policy, that can be better than sticking to the whole thing has to be enacted in a policy, or the whole thing needs to be sustained, because you might lose that opportunity entirely. And then lastly, ownership. Often sharing the responsibility of these interventions and of the policy change can be more effective than trying to retain sole ownership yourself. Not a polling question, just something to consider for the discussion later on, or to reflect on yourself of whether any of those policy lessons learned actually resonate with your own work. And I will leave this last slide with you, some key takeaways around policy in general, but I've already spoken to most of these, so I'll wrap up there because I think I want us to stay on time.
Great, thank you, Chris. And we've had a few people ask about whether your slides will be available. So again, the recording afterwards will be available, and as well we can get the slide presentations up on the website as well if people want to download them. So that's great. So again, if people want to submit a question now for Chris, we will have some time at the end for a Q&A. So if you're able to put your questions in now, then we can already sort of start to field them and get them ready for the Q&A session. But I'll pass it now back over to Mary, and she's already showing her
and I'll throw it right back at you so
that you can. Yeah, and here's the slide.
Excellent. Yep. Okay.
Great.
All right. Thanks, Chris. That's excellent, and really good news about the budget. Congratulations. And we have been, Nourishing School Communities is a $2.4 million over 3 years, which I believe was the largest ever single contribution to school food, and I'd like to think that we've been productive stewards of that federal money. So again, thank you for that. So you're saying, wow, what a slide. Look at all of this information. So I'm not going to be able to stay on it for too long, but I'm hopeful that you see yourself as part of this webinar somewhere on that slide. I'll draw your attention to the far left on the food environment. So this is all the physical aspects of food and the social aspects, behavioral aspects of food. The food literacy, which has expanded considerably in recent years and beyond the classroom to the facilities that support food. Also thinking about the literacy that can occur and the various literacies that can occur around food. And you may see yourself in one of the, on the far right, although we don't have funders there, something to add, the stakeholders. And then above that, really thinking and considering the importance of monitoring and evaluation, so everything from the changes that may occur in schools to what happens as a result of them. So do the students have an uptake of the changes, and then finally what kind of outcomes are there in terms of their health and education and impacts on the community. And lastly, right at the top, thinking about cross-cutting themes, so access to food by students, so students who are coming to school without food or the opportunity to purchase food. How do we address the food environments for them and food literacy opportunities? I see Indigenous isn't capitalized, it should be. We have some amazing examples occurring across the country in school communities, so those of us in the non-Indigenous communities could learn a lot from what's happening there. So if you're new to this area, I encourage you to check that out. And Micheline has her contact information at the end, but I'm also happy, she would forward any information to me, and I'd be happy to field questions on that because, as I say, we have a lot to learn. Also very important to think about the people who are going to be providing this education and these services, and to ensure that they have the background that it helps them to do it in the most effective and supportive way. And thinking about the sustainability of food systems, so bringing in environment and local and these dimensions. Our outreach, excuse me, to parents and communities, very critical. These you'll see in a few minutes, the stakeholders and how important they are. And finally, the synergy. So if I could take that slide and just kind of go whoosh and mix it all up, then that's what I would do, because although these are in discrete columns right now, ideally we want them to be blurred and mixed and working effectively together. Next slide, there we go. So just quickly, so as I mentioned earlier, all the provinces have policies now. All of them will address, and that's why it's in red, the nutritional quality of food and food facilities or outlets within a school. And then all of these others, meal scheduling, food intake of staff, food pricing, fundraising, food safety, at least one of the provinces addresses those items. And this list is not exhaustive, but it does fit within the context, or show you within the context of comprehensive school health, that quite a number of our policies are addressing additional aspects, and so helping to make the policies more comprehensive, which I believe is a strength of policies. Okay. I also want to have a shout out to the fact that Nourishing School Communities has had a heavy emphasis on local and sustainable food. So when the policies, the provincial policies were developed, that was not as much on the radar, I believe, as it is now. So there's no policies that have a specific local sustainable component at the time. They will encourage, but it's not sort of like, hey, you know, this needs to be part of it. If we are to look at the local and sustainable aspect, then specific components, policy components that would be important to consider would be, how is the food going to be procured? Again, how are the people going to be trained that are going to provide that food? Public health, food safety, insurance, liability is always an important aspect. How are we going to ensure that all students can have access? How are we going to take this enriched food environment into our learning aspects around food? What facilities are going to be available to support that? And you can see this photo is from a school garden. And then also the work that is going on in schools can be tied to larger initiatives that are occurring in municipalities, and also around environmental concerns, so reducing our carbon carbon footprint, etc. So a very rich area of future policy work to be done on this topic. So I just want to spend a little bit of time thinking about policy monitoring. And for those of you who are kind of new to the policy process, the good news is that we're not starting from scratch in for the most part. But the bad news is there is still work to be done. So whereas Chris mentioned about agenda setting, excuse me, and policy formulation and policy adoption, you say, well, everybody has policy, so what's left to be done? We're not so strong. I mean, some would argue that the policies themselves could be strengthened and enhanced or expanded, and also the implementation is still and continues to be a challenge, and that's hence the questions that I posed at the beginning. And evaluation is still not occurring consistently across the country. Now, some of the provinces, and you'll see a few little excerpts in the next couple of slides, have done, researchers within the provinces have done pretty extensive work. Manitoba, the government has done a fair bit of policy monitoring. In New Brunswick, where I'm from, we haven't actually done formal policy monitoring, but so if you're saying, well, we haven't either where I'm from, so this is an example on the right-hand side of Make Menus Matter, and so this was, I would say, informal policy monitoring. It would not pass the rigorous evidence test, but at the same time, it has been a very useful, from a policy perspective or political perspective, it has been very helpful in guiding and encouraging our government to take further action around policy. This was an initiative, or this is an initiative by the New Brunswick Dietitians in Action, of which I am one, as well as our New Brunswick Medical Society. And I will say that having the Medical Society's involvement, it was very helpful because of the political clout that the Medical Society has, and I have to say it is larger than the dietetics political clout, and also their ability to make nice graphics and things such as that. So we are very grateful for their involvement. And while it is difficult for you to see, what do these red and green mean, basically the basis of this was that we put out a Facebook request for schools to submit their cafeteria menus, so as simple as that. And then in addition, dietitians went through the different districts, and if they found cafeteria menus online, they lifted them. This was not a blame and shame, name and shame exercise, so names of the cafeteria menus were, the schools where the menus were occurring were removed, and then the dietitians went through and by face value, so that's why it's at 24 were unclear, based on face value, looked and see how they complied with the menu. You can see that in and this has been 2 years so far, but in the second year we had about a third of the cafeterias, so a significant number. Now, I'd also draw your attention to the right where you see all the red and then you see all the green. So it's very interesting in New Brunswick. The red schools tend to be, those are the Anglophone schools, and the green schools, the first three green schools are the Francophone schools, and the school on the far right, lower far right, that's all in green, that's Indigenous schools. So again, my earlier comment, some amazing things are happening in our Indigenous communities is borne out by this little graphic. Somebody asked me recently, why the difference between the Anglophone and the Francophone? I think if somebody wants to pose that as a question, I will try to answer it, but I'm not going to be able to at this time. But it is fascinating to see the difference. Well, I will quickly say that the Francophone schools tend to have more social enterprise cafeterias where the overall aim is not a profit, whereas the Anglophone schools tend to have a higher number of for-profit, larger school food service providers. Now, I'm not saying that makes it easily defined, but I think it is an interesting and worth pursuing in terms of an observation. The results that I'm going to quickly go over in the next couple of minutes are from the policy documents, from reports, and from journal articles. It's formal and it's informal monitoring. So we cannot say that the changes that you see here are due to the policy specifically. We can only say that after the policy was developed, these changes were observed or reported on. We don't have randomized control where we have a control group where there was no policy and then we have the policy to see that, yes, it was due to the policy. At the same time, I think it is interesting to see many of these changes do reflect components of policy, so we would like to think that the policy has had an influence on these changes. And in some cases, the researchers asked, what was the influence of the policy? And indeed, yes, the respondents said yes, we made these changes because of the policy. So I'm hopeful that as I've been chit-chatting away on that slide, that you've been looking at examples of what kinds of changes have been made. Then you say, okay, well, the changes got made. Did the students eat them? Very, very important question. And so actually, we have some, not all of the research has collected that information. Where it has been collected, it's not as glowing as we might think. So again, that points to the earlier questions of, how do we make it more part of the educational mandate? How do we get people involved in the spirit and not just the letter of the policy? Do we need some other tools as well and other strategies to add to it? Because as you can see in Prince Edward Island, for example, more kids ended up bringing their lunches to school after the implementation of the policy. Now in Nova Scotia, where they pre and a post, which was helpful, there was somewhat of an increase in milk consumption. The sugar-sweetened beverage intake increased significantly. If you don't work in schools now, please note that full-calorie sugar-sweetened beverages are no longer in schools or should be in schools, K through 12, and that's a voluntary policy of the beverage companies that has resulted in that. And we're not there yet in consumption of vegetables and fruit, so no change in the consumption of vegetables and fruit. Challenges. So examples of challenges. Historically, schools used school food to raise money, and often too, if the district signed a contract with a school food provider, then money was returned to the school district, so a certain percentage of sales. So revenue was obtained in a couple of ways. With a decrease in sales, the children voting with their students voting with their pocketbook, that has created challenges for schools and school districts that relied on that money. So that has been a big challenge. Parents and homes, it's very easy for finger pointing to occur, so the parents say, well, this is our responsibility, or the schools say this should be the parents' responsibility. I would suggest that, if the school is offering the food, then it becomes the school's responsibility, so they need to take that responsibility. And in some cases, we have concerns about the complexity of the policy itself, and also too, how do we get these students to start enjoying that original vision of mine, enjoying the taste of healthy food. There are supports, though. This photograph is Clifford Larry. Unfortunately, he passed away from cancer, but he was a wonderful member of his community in Eskanovich, and he was a chef. He was a school chef, and he really embodied what I'm trying to say in terms of that spirit of the policy. So champions can be very important, and these again are identified from the literature. Having the support from key administrators, superintendents, principals can make a big difference. Interesting too that the personal beliefs, and I would say we're still at the point where we are idiosyncratic. In other words, we can't go into a school and say, oh, this is going to be a healthy school. So those are important. And you see too resources to support implementation and success. So when they saw that policy had some success, then they were more likely to believe that it was important to continue. So success breeds success. Recommendations from the research are to strengthen the policy implementation, build on the successes achieved, have more resources, include students more. Oftentimes students are passive recipients of these policies. They may not even know that the policy exists. Having more accountability and having more monitoring. You'll see on the right-hand side, this is it's a fish dish, as the school was trying to include more fish in the school menu. It was not an overwhelming success in terms of student uptake. And you may ask, well, are they doing this for the policy or are they doing it for other reasons? And in this case, they would be doing it for other reasons. They want students to enjoy the taste of fish, and the policy kind of becomes a backdrop. So we, again, going back to my questions, we have to think about, you know, how that relates. And Micheline, I have quite a few slides on that, and I think we're just going to skip through those, and we'll see if there's any questions around those or comments. So you can go to your, well, we'll go to the framework, the after-school framework. So you can just carry on here.
Okay, great. Well, I'm just going to quickly, and I mean, this is really, we have some of our partners on the line, so it's just recognizing the work that with Nourishing School Communities with regards to policy impact, where we've started to see some policy changes or some new developments. So again, Mary, maybe because of your involvement with the Healthy Eating Framework, best for you to talk to this quickly, and then we can keep going.
Sure. So this is with the YMCA as our partner, and Sharon Brodowski and I were integral to this. And you can see that as part of the framework that we developed, policy is over there on the left. So again, we see it as part of and adapted it from comprehensive school health. See it as integral to the overall work of the YMCA's. And I'm pleased to say that while we had 3 YMCA's to help us develop this framework, quite a number across the country have now adopted it. And we also included a self-assessment tool, which they have found very useful, and they are adding educational, professional development tools around what they're doing. So
Great.
There you go.
Thanks. So, and I just wanted to, again, note some of the things that have been happening with the Farm to School programs, and I'm going to just share 2 examples. So this is in New Brunswick, one of the school districts that has looked at, with their RFP that goes out to food services, making some changes in that RFP process around what food services requirements for cafeteria operations would include. So we've highlighted some of the, you know, the new aspects that are there around fresh, local, that food services should be purchased from New Brunswick. So this is just an example, again, of where, you know, it's having it in that documentation, having it in the process. So when food services are, you know, submitting an RFP to be to serve in schools in this school district, these are things that they're required to do. And actually, there was a longer list, and comprehensive school health was on there too, but I didn't include it. So there's again an example. The example that Chris gave earlier around what's happening in Indigenous communities with the CAECO project, we're seeing, you know, great work as well happening in Haida Gwaii with the work that they've been doing on local food to schools and integrating wild harvested and foraged and locally preserved food into school menus, and making some great opportunities to have food served, and in some cases it's required looking at, you know, some regulations around what food can be served. And I know now that in the schools in Haida Gwaii they can serve, you know, deer meat, they can serve fish, and that, which in some cases wasn't possible before. So that's really exciting. Also looking at, you know, some of the things around sort of organizational change. They've been able to have a pantry and have funding for that. So, you know, it's about storing food and then having it being able to use in the schools and other institutions, you know, throughout the year. So that's really exciting. And then it's as well looking at how things are transported and enhancing that system. So those are just a few examples that, again, are you know, it's how things, the systems change that are happening to support this work moving forward. And then just lastly, around, you know, one of the schools that we're working with in Newfoundland, in St. John's, St. Bonaventure School, they're looking at drafting a policy, and here are some of the things that they're looking to include in there, which I think is really exciting. So again, many of you, you know, working in different provinces, seeing how, you know, enhancements could be made to policies that are already existing, whether it's school-specific policies or policies for district. I think there's still lots of opportunity there. And one more thing, I know Ruthie's on the line from the Lunch Lady. It's about organizational change too. So as a private food provider, the Lunch Lady, who's in 4 provinces, has really had some key organizational changes with regards to, you know, what's being served on their menu, what the process is for ordering food and cooking operations, hiring new staff. So these are things, again, they're policy changes because it's things that are changing at the organization level to support bringing in more healthy and in some cases with the Lunch Lady as well, looking at opportunities for cooking more from scratch. So great opportunities there. I'll turn it back over to Mary to conclude, and we're not going to have much time for Q&A, but I'll let Mary go ahead.
Well, I just wanted to say that if you are excited and say, you know, yes, I don't know much about this right now, but I'd really like to get involved, there are opportunities. So Farm to Cafeteria is working more in Micheline just gave a couple of the examples more sort of in that informal policy arena. We've got people on the line from the Coalition for Healthy School Food who are working at the national level in particular, but also locally and regionally and provincially and territorially to try to strengthen the access to school food for school children, and particularly to involve and invite our federal government to play a larger role in terms of their support. And this photo is from a recent Big Crunch. I'm not sure how many of you participated in the Big Crunch. It was held on Parliament Hill and had 15 parliamentarians participate. So yes, the last slide. In New Brunswick, last year we had Where to Eat in New Brunswick schools. It was part of the Make Menus Matter initiative. So part of the rest of my vision is that every school in Canada becomes a Where to Eat school. So thank you very much.
Okay, and we'll leave it on this slide just so people can take down, if they don't know, again, in the province, more information around policies. There's the links there. Again, you can get this after. We do have time for a few questions. I'm going to pass it over to my colleague Pascal, who's been watching the question and answers that you guys have submitted, and we'll have time for one or two. And what we can do then is send those questions to our presenters, and we can have them answered and submitted online for those that we don't get to today. So I'll pass it over to Pascal. All right, so this question is a little bit more for Mary, and it's from Gayatri Murphy, who asks, were fundraising policies, food-based, monitored as well in New Brunswick? So provinces have suggestions for healthy fundraising practices, but would having mandated policies be helpful?
I understand the question correctly. Some of the policies, and New Brunswick is one of them, that do say that fundraising should be either done without food or food sold of minimal nutritional value. Not all of the policies across the country, however, contain that clause. And then if the monitoring, so you're right too, that a lot of the monitoring has been done around what is available, what foods are available, and less monitoring done around those other aspects of policies. I'm pleased to say that in New Brunswick we are actually undertaking an activity or an assessment right now. It's under the leadership of the Department of Education, and fundraising will be included in that assessment, and that will be completed by the end of June, and 25% of the schools are going to be assessed.
All right, thank you, Mary. And so the next question is from Ian Parker, and he asks, I'm curious about the parental resistance that was encountered in Alberta. I assume if policies only covered foods served/sold in schools, that this would still allow parents to pack whatever they want with their kids.
Yes, the provincial policies all stay out of encouraging or stay out of mandating what students can bring to school, so you're absolutely right on that. Schools may have, as individual schools, may have policies about what can be brought and what cannot be brought, and so yes, I would agree with you. Given that they are not being told what to do in terms of what the students bring, why is there that challenge? It's a good question. I don't have a great answer, but I will say it does exist, and it's not just in Alberta. It is elsewhere also. That I think that part of it is this notion of nanny state. I think part of it too is again, I have a heavy recommendation that we involve the parents as well as the students, and we don't make them just kind of passive recipients of this. And help them see that it's not this isn't obesity, health, all of this. It's not an or problem. It's not families or schools. It's an and issue. And so we need to have families and schools and communities and others working together on this topic. So I think we need to recognize that the resistance can exist, and we need to think about how we help everybody see that it is an and issue.
Great. Okay, so now I'm going to ask one last question before we wrap up. Is there a national policy for culinary teachers or food teachers? And if not, would you be able to help this set up?
At this time, there is no national policies in education, of course, because education comes under provincial and territorial jurisdiction. I think that that's an interesting idea. I used to teach in home economics education, and we see the lack of that occurring now. The closest that we've got to anything national is that the federal, provincial, territorial group on nutrition developed nutrition standards in 2013, but that's not what you're talking about. But just to let you know that that does exist, and yeah, you could Google those if you were interested. The uptake of those, even though health ministers were asked to express interest in adopting them, I'm not sure that the uptake has been that strong.
Well, thank you, everyone, and thank you both to our speakers, Mary and Chris. Great, insightful knowledge here. I'm sure we could go another few minutes here with more questions, but we're going to wrap it up now. And if people do have any additional questions, they can email me, and I'm happy to link you with our presenters. And thank you all for your participation, and have a good afternoon.
Thanks, everybody, for joining us.
Thank you.